I've learned tonight all protocols observed. That may be the one thing that I take away and use the most often from tonight. But I can't begin without saying it's a true honor to be in the presence of Jim Kim and Dr. Farmer. You are mentors and role models for many of us that have entered the development field, and also Kojo Nnamdi. I have to say as well, it was a true draw to be able to be on a stage with Kojo Nnamdi. I want to thank you for the opportunity to allow me to participate in recognizing the government of Pakistan and their achievements. I'm honored to be here to help recognize their incredible work tackling one of the deadliest and oldest infectious diseases. Pakistan has shown outstanding leadership in the fight against TB and the multi-drug resistant strain, or MDR-TB. Over the past 5 years, the government of Pakistan has proactively involved the private sector in the diagnosis and treatment of MDR-TB patients, and has increased the number of MDR-TB detection and treatment sites in the country. This has, as mentioned, led to a remarkable 6-fold increase in the number of MDR-TB patients enrolled in treatment over the past 5 years. With this expansion, the government of Pakistan has been able to maintain high-quality MDR-TB diagnosis and treatment programs with one of the highest rates of successful MDR-TB treatment in the world. The role of the private sector health service delivery in tackling TB and MDR-TB in Pakistan has been crucial. Their active involvement in the government's leadership and coordination have been essential to ensure quality and effective implementation. Since 2004, USAID has been proud to be a partner with Pakistan's National Tuberculosis Control Program, supporting quality TB diagnoses and treatment services, as well as introduction and scale-up of multi-drug resistant services. In addition, the Global Fund for HIV, TB, and Malaria has been an important partner in achieving these gains. The U.S. government is the largest funder of the Global Fund and the main technical assistance provider for the grants. The USAID TB program will continue to provide targeted support for implementation of the grant. Over the past 15 years, the world has made great strides in combating TB. We need collectively to intensify our efforts on tackling MDR-TB, as was outlined in the White House MDR-TB National Action Plan, and as has been echoed already tonight by several other speakers. With continued action, investment, and partnership, we can end the global tuberculosis epidemic. We are honored to recognize the government of Pakistan's leadership in this effort through this year's TB Champion Awards. I would like to invite Ambassador Jalani to come to the stage to receive the award on behalf of Pakistan's Ministry of National Health Services, Regulation, and Coordination.
Thank you. Thank you so much, Mr. Larry Sampler, for your gracious introduction. Larry has certainly been a wonderful partner, and he has made tremendous contribution in building a strong developmental partnership with Pakistan. I'm grateful to Dr. Pablos Mendes, Assistant Administrator for Global Health, and the entire USAID team for organizing this important event. We are honored by the presence of Dr. Jim Kim, President World Bank. Thank you, sir, for your recent visit to Pakistan. We were greatly honored. And thank you for your positive remarks regarding the reforms agenda introduced by our Prime Minister. As you rightly pointed out, Dr. Kim, that we will soon be passing on the benefits of these reforms to the people of Pakistan. Distinguished guests, it is a matter of great honor and privilege for me to convey profound gratitude on behalf of the government of Pakistan for the TB Champion Award. It certainly constitutes an international recognition of our national achievements in combating tuberculosis. This award is a tribute to the managers and workers of TB control program who work tirelessly to enroll and treat a large number of TB patients in Pakistan. Ladies and gentlemen, this award brings mixed feelings. Despite the fact that our accomplishments against tuberculosis have lifted our spirits, its continuing prevalence, incidence, and mortality makes all of us think about those who still suffer from it, not just in Pakistan, but around the world. I'm especially thankful to USAID, which is working closely with Pakistan to improve the health and well-being of the people of Pakistan. USAID has been a long-standing partner in Pakistan. Its programs target the poor and most vulnerable areas where communities often lack access to comprehensive and reliable health service delivery system. USAID efforts in the area of TB control are of particular significance. It continues to be a key partner of Pakistan's national TB control program. USAID's health program are increasing access to family planning services, improving maternal and child health care, controlling major infectious diseases, providing safe drinking water, and strengthening the capacity of our institutions. Distinguished guests, Pakistan and the United States are closely cooperating in the health sector. This bilateral health cooperation was also discussed at the highest level between the Prime Minister of Pakistan and President Obama when our Prime Minister visited Washington in October 2015. Both leaders agreed on the importance of enhancing measurable capability of Pakistan to prevent, detect, and respond to infectious diseases. They reaffirmed their commitment to fully implement the global health security agenda with a view to advance global cooperation across sectors to counter biological threats. It is a matter of great satisfaction that our immunization program under the Global Health Security Agenda is being strengthened to prevent, detect, and respond to infectious diseases threat and has a roadmap in place with the support of Center for Disease Control. Pakistan is a developing country with high population density. The landscape of public health is riddled with multiple challenges. TB control being one of them. The country harbors the 5th highest burden of TB in the world, which is around 5% of national disease burden. Recognizing the enormous socio-economic implications of the disease, the government of Pakistan responded to the situation by declaring tuberculosis a national health emergency in 2001. I would like to highlight that the Prime Minister of Pakistan has recently launched a state-run health insurance program for the poor segments of the society for the first time in our history. The health insurance would not only provide the social security net, but would also help the underprivileged in combating diseases like tuberculosis. It is the cumulative outcome of our national efforts and international cooperation that tens of thousands of additional patients of MDR-TB have been treated in Pakistan in recent years. Our joint efforts have led us to one of the highest treatment success rates in the world. TB is a curable disease but continues to form a global health problem. Pakistan forms a success story in combating this challenge. Our National TB Control Program conducted national prevalence survey for TB in 2010 and 11. A national strategic plan has accordingly been developed. It encompasses WHO-endorsed global TB strategy, the development of national guidelines on TB case management, and training material have been extremely helpful in combating this disease. Under the National TB Control Program, more than 3 million TB cases have been diagnosed and treated free of cost in 1,300 public sector TB care facilities during 2001 to 2015. Ladies and gentlemen, I am confident that with the support of our partners, international and national organizations, and private sector, we shall not only succeed in controlling tuberculosis, but its eventual eradication. Let me conclude by reiterating gratitude for the award. I must acknowledge the commitment of all national and provincial agencies, TB control programs, international community, and the private sector in strengthening our resolve and capacity against this disease. The award signifies the triumph of partnership. Pakistan continues to believe in the strength and value of building and sustaining partnership geared to dealing with global challenges. Thank you so much, ladies and gentlemen.